right now I want to bring in a New York hero, New York City ER doctor Calvin Sun. Dr. Sun, first of all, I just want to say thank you. How are you doing? How is your health?
I am still alive, still breathing, and as of knock on wood today, still no symptoms, but every day I work, I have to add another 25 days to the clock because that's how long symptoms can take to manifest.
Well, I appreciate you going to work every day. And during these days, you have been in a bunch of different emergency rooms. Do you see signs that things are leveling off, things are improving in any way?
So New York is great, and New York is at its best, as a born and raised New Yorker myself, in response to tragedy. So even last week, I was reporting about how dire the situation was, but I also neglected to mention how things were being put in place that were decompressing a lot of the emergency rooms, such as outside field hospital tents, and hospitals finally working together to transfer patients out that were waiting up to 80 hours for a bed, so they didn't have to, and they would go to hospitals that were larger, had more availability. So there was this constant wave of ebbs and flows that every day felt like the apex, and then things got better. And now we're holding our breath. Everyone's saying this is the worst week ever. It sounds like people are listening to that, but what if that this is just a blip, as everyone says, just like in the stock market, where something looks good and then just crashes? Because people then can take this news and say, okay, I'm just one person. Let me just go outside and just take a chance. And then they risk exposure and giving it to other people. And then the next week is actually the worst week ever. We don't know these days. As of right now, the last couple of days, it plateaued. But plateau doesn't mean there are no patients. Plateaus means it's 800 on top of 800, top of 800, and it takes about 10 to 14 days to recover. So it's still overwhelming, but it's encouraging. But I don't want to speak too soon.
New York's public hospitals have been the most overwhelmed, those that don't have massive private funding. And we actually saw, sort of what New York City looks like play out, where you've got the richest of the rich and the poorest of the poor within miles of one another. Have we addressed this, and are we seeing all New Yorkers get help? Because what we don't want this virus to result in is the greater divide between the rich and the poor.
Well, I went into emergency medicine because I'm here to treat all. I'm a per diem doctor working at all the hospitals, public and private. And what I have noticed is that every emergency room is going through the exact same thing. But the hardest hit neighborhoods, the most endemic areas, are the communities struggling with lower socioeconomic thresholds, the people who have not enough access to better care. Those are the things that you see in the map, with the darkest red colors are in neighborhoods that primarily are the ones that you would see on the have and have-nots, whereas the communities that haven't been hit as hard are the ones that are of higher socioeconomic averages. So, but that doesn't, regardless the fact that emergency rooms are packed, and now we're working together in one hospital systems, we're sharing patients, so we're treating all. But what does it mean for the availability of access to us as healthcare workers? Hospitals are all lacking something. We had this issue even before this pandemic. So what about the workers ourselves? And when we go to work every day feeling unsafe, feeling like it's a suicide mission, like I even just said, I have to add 25 days to the clock, because even as adequately I am prepared 1 month in, it's still a liability in terms of, it's not a perfect standard of care that we are seeing in outside countries.
Is that how you feel? Do you feel like every day when you and your colleagues go to work, it's a suicide mission?
Oh, yeah, absolutely. Like, we don't have a clean room that some places outside the United States have, where we can actually have a safe space to put on all our gear. Let's say I even have my chemical hazmat head-to-toe bunny suit. I'm putting on that in the break room, the 3 feet by 10 feet break room where we all eat and congregate together, where we can maintain 6-foot social distancing rules, the place where we take off our masks so we can eat, let alone breathe the air if this virus is actually aerosolizable and lives in the air. That's where I put on my hazmat suit and my P100 masks. Like, there's no place like that. So I probably would have caught it even in the break room. If somebody's sick, had sneezed in there. Like, that's on my mind constantly. That's only the first 5 minutes of my shift. And then as I go in and see as many patients as possible, the way emergency rooms are set up, patients are packed, right? It's not like every patient has their own room. Emergency rooms in New York City sometimes are just one giant rooms where patients are separated by curtains, so that when they're full, they're literally 1 to 2 feet away from us. We can't even force the 6-foot social distancing from patients, let alone ourselves in their workstations among staff workers. As you can see from the video, everyone's kind of close up next to each other. If we've been exposed and we're exposing to each other, it's all on our suits, all on our thing. And where do I take this off? Outside of the hospital, inside the break room? It's something that's all on my mind. So I always have to add 25 days as a possibility that I might catch this virus.
Then what is this dress doing to you and your colleagues? What do you want America to know about what you're going through, about what we need to understand?
Way before this pandemic, physicians as a whole, my community, was suffering from a suicide rate twice the national average, even before this pandemic. What I'm worried about, and it's too soon for me to say, is that for all healthcare workers, this is just the beginning for us. What happens afterwards? What happens if this week isn't even that bad, right? It's not the worst week ever, and everyone gets upset at us, healthcare workers, for overreacting, for saying, oh, you wanted too many ventilators and too many this and too many that. I'd rather have that reality, that y'all be upset at us for overreacting, than the other reality when we don't have too few ventilators and that we have to ration care in the United States of America in the year 2020, that, you know, I'd rather have too many beds rather than too few. But the issue is that regardless of that scenario, we're all been already scarred. PTSD is very prevalent among community, where we wake up every day now wondering if we have a fever, as if a soldier wakes up every day wondering if they've been shot. And if this is just the beginning, what happens afterwards when already some of my colleagues are dead or on life support? The reason why I've worked so many shifts is because so many colleagues have been so traumatized by the experience that they are calling out sick, they're hospitalized themselves, or they have lasting, enduring, disabled lung injury from being intubated. And then after that, the moral injury that we face after this pandemic is over. How do we go back to work feeling that we've been adequately protected and adequately prepared, especially when the possibility of another pandemic may be around the corner?
Dr. Sun, thank you so much for sharing your expertise, your insights, and also how you feel. While I know we can't answer those questions for you yet, I can tell you how much we appreciate all that you've done and all that you continue to do.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.